This one, madam. This one. Good evening. I am Dr. Anshika Pathak, consultant at Venu Naturopathy Centre. I am your host this evening and I am honored to welcome you to our first public interest talk on managing diabetes and integrated approach on the occasion of World Diabetes Day. As we begin today's session, I request Dr. Maria Libre-Ross, Executive Director, Venu Naturopathy Centre, to welcome our respected guests. As a token of our commitment to natural healing, we present the insulin plant. Yes.
उसको साइड में सारे उठा
I now call upon Ms. Sujaya Krishnan, Chairperson of Venu Charitable Society, to extend the welcome address. Ms. Krishnan, a distinguished member of 1980 Civil Services cohort, formerly served as Joint Secretary in Ministry of Health and Family Welfare. She was in charge of the National Mental Health Program, National Program of Healthcare of the Elderly, National Program for the Prevention and Control of Blindness, Deafness, and the National Program for Oral Health and Fluorosis. A graduate in economics from the Madras University, she holds double postgraduate degrees in English literature and public administration besides a postgraduate diploma in business and industrial management. She is a trained educational planner from the International Institute of Educational Planning, Paris. Currently, she is the chairperson of Venu Charitable Society, member of Guild of Service, and on the board of advisors for White Swan Foundation. Ma'am, please.
A very good evening to all of you. Chief guest, Dr. Padma Vibhushan Dr. Sonal Mansingh ji, distinguished speakers, panelists, Dr. Anoop Misra, Dr. Puneet Misra, Dr. Brigadier Dogra, Krishna Maurya, esteemed members in the audience, ladies and gentlemen. On behalf of Venu Charitable Society, it is my privilege and pleasure to extend a very warm welcome to each of you present here for the discussion on managing diabetes and integrated approach on the eve of the World Diabetes Day. World Diabetes Day was designated by the UN General Assembly in 2006 and is celebrated on November 14th each year. WBD provides an opportunity to raise awareness about diabetes as a critical public health issue and emphasize the collective and individual actions needed to improve prevention, diagnosis, and management of the condition. This year's theme, Breaking Barriers, Bridging Gaps, underpins our commitment to reducing the risk of diabetes and ensuring people diagnosed with diabetes have access to equitable, comprehensive, affordable, and quality treatment and care. Today's discussions are a part of Venu's efforts in raising awareness, spreading knowledge, and creating lasting change for all affected by diabetes. The expansive growth of the diabetes epidemic goes hand in hand with the increase in its risk factors. Halting the rise in diabetes is possible and goes hand in hand with implementing strategies, among others, such as prevention of diabetes risk factors, especially overweight, obesity, and inefficient physical activity. Access to quality diabetes education guarantees adequate training of the healthcare team, people living with diabetes, their immediate environment, their caregivers, and society in general. Diabetes and well-being should be the theme. With appropriate access to diabetes care and support for their well-being, everyone with diabetes has the chance to live well. Millions of people with diabetes face daily challenges of managing their condition. They must be resilient, organized, and responsible, impacting both their physical and mental well-being. Diabetes care often focuses only on sugar, leaving many overwhelmed. It is time to put well-being at the heart of diabetes care and start the change for a better diabetes life. 36% of the people with diabetes experience diabetes distress. 63% say that the fear of developing diabetes-related complications affects their well-being. 28% find it hard to remain positive in relation to their condition. According to Lisa M. Bessel, in an August 2021 medically reviewed article in Health Central, adding a naturopathic doctor to your diabetes team can help you better manage your health. If you have diabetes, maintaining healthy blood sugar levels is likely to be at the forefront of your mind. Where your body doesn't make enough insulin or doesn't use what it makes effectively, living with diabetes can sometimes feel like a constant balancing act. When your body cannot manage your blood sugar levels, it can affect your immune, nervous, and circulatory systems, which is why it is useful to manage your diabetes with a comprehensive approach. You can use both conventional medicine and naturopathy to develop a plan that helps you feel better and reclaim control of your life, of your health. Some people do turn to naturopathy to manage their diabetes, there are a few things that you need to know about naturopathy. It aims to address and remove the root cause of a person's disease to promote their healing response, according to Alice Fong, and ND and CEO and founder of Hammer Soul. Naturopathy aims to restore and establish optimal health. Many naturopaths use nutrition, hydrotherapy, acupuncture, and other modalities for curative. Contrary to popular belief, naturopathy is not anti-medication. They recommend natural substances that can be used along with your pharmaceutical drugs prescribed by your endocrinologist or allopathic doctor. In many ways, naturopathy encourages you to be an autonomous player in your own health. According to the journal BMC Complementary and Alternative Medicine, several small uncontrolled studies found improvements in self-care behaviors and reduction in clinical risk in persons with type 2 diabetes who receive care from a licensed naturopathic physician. But randomized clinical trials will be necessary to determine if naturopathy care was responsible for these benefits. As Fong explains, diabetes is a gradual and progressive disease, which means reversing or preventing it hinges on adapting some new practices. Even small changes can have a big impact. With the healthy lifestyle interventions, perhaps they can avoid more medications and depending on their blood sugar levels may be able to reduce their dosage of medications. Fong says there is value in medication, but diabetes medication alone will not cure diabetes. What can prevent and possibly reverse the progression of the disease are lifestyle changes. If you are at risk for diabetes or you have been diagnosed with pre-diabetes or it runs in your family, along with the other risk factors, you also should know that type 2 diabetes is preventable. Naturopathic medicine is so important in the management of diabetes because it is primarily focused on prevention and health optimization using lifestyle changes, says Fong. In the end, you need to know that you have the power to make life choices that benefit your mind, body, and spirit. Because your health isn't about the number on the scale, exercising the most, or eating perfectly every day. It's about creating and sustaining healthy balance in all areas of your life. At the Venu Naturopathy Centre, we are dedicated to promoting an integrated approach to healthcare that combines the wisdom of traditional practices with modern insight to combat lifestyle diseases. Our aim is to create a platform where experts from diverse fields can share their insights, fostering a collaborative approach to healthcare that benefits society at large. Our aim is to bridge the gap between conventional and traditional medicine. We believe that a balanced, integrative approach can lead to a more effective and personalized healthcare solutions. Research increasingly supports combining naturopathic principles with conventional treatments to achieve a more holistic approach to diabetes care. This integration can address the root causes of the disease and promote overall well-being. At the Venu Naturopathy Centre, we are committed to promoting understanding and collaboration between specialties, and we aim to promote ourselves as a flagship institution for integrative patient care and research in naturopathy. Working alongside specialists, we hope to bring evidence-based naturopathic treatments into the mainstream of diabetes management and to improve patient outcomes. At the centre, we are committed to integrating naturopathy with conventional treatments to enhance patient outcomes. This integration does not replace but rather complements allopathic approaches, allowing for a more well-rounded, patient-centered form of diabetes care. We are eagerly looking forward to the possibility of working together to make a real difference in diabetes management and care and for collaboration to improve patient outcomes. Today's event aims to bring together specialists from various fields, including endocrinologists, ophthalmologists, physicians and naturopathic doctors, to explore the potential of integrative care in improving diabetes outcomes. This dialogue is Venu's effort to break down the barriers and bridge the gap in keeping with the World Diabetes Day theme, to bring together the conventional and the traditional, allopathy and naturopathy, and to work in tandem so that we can walk the path towards a more patient-centric and healthy life experience. We believe the time has come and the time is now, so let's do it together. I wish the deliberations every success and for the audience useful and valuable takeaways. Thank you.
Thank you, ma'am, for the valuable information. Our first speaker is Dr. Krishnan Maurya, Medical Director, Venu Naturopathy Centre. Dr. Maurya has over 15 years of experience in the field of naturopathy. He will guide us on the naturopathic approach to managing diabetes and its benefits. Sir, please.
Good afternoon. Today I'm going to explain something about naturopathy. I'm already explained a lot of things about naturopathy in brief. And here again I want to draw your attention how naturopathy works and what is naturopathy and what is how we are treating disease in naturopathy and how it affects, how it give a good effect to our system. So first of all, what is naturopathy? Although we know a little bit about naturopathy, so it is a system of medicine that emphasizes the body in an ability to heal itself. So basically our focus is more and more healing, and that too itself, but we are providing the opportunity. And we use natural therapies such as diet, exercise, hydro, herbal, yoga, acupressure, acupuncture, and many more we are using. Then how naturopathy defines diabetes. So here the allopathy system or any other system, they have their own explanation about the diabetes, but naturopathy sees here it is a mixed encumbrance. So because of that, the diabetes, we say the diabetes affect the encumbrance, diabetes enter in our system. In case of diabetes, actually what happened, the unique flow of vitality get disturbed, but result in organic changes visual through abnormal sugar level and insulin resistant or other complications. And the causes. So causes are most important in naturopathy. We focus on the cause, and based on the causes we are deciding many things. So diabetes is actually a multifactorial that we know, which classified into different types based on its pathogenesis. So here I wanted to again draw your attention that the diet. In India, India is a carbohydrate-rich country, and we are consuming a lot of carbohydrate in any form. Carbohydrate and fat. That is one of the big reason for the diabetes. Then the your digestive health. So and gut is also play important role. Imbalance of gut, that also create a issue. And for example, here I took the microbial environment within the gut can trigger the beta cells destruction. So which is again responsible for the diabetes. And of course the stress, and especially these days the stress is different. Earlier the stress level, the type of stress was probably different, but these days it is different. And it is more emotional. And because of that, we know that if it is more emotional imbalance or more emotional stress, that constantly can increase the sugar level. So that is also very important cause we are addressing and we have to address. And of course the environmental toxins. So that also play an important role in diabetes. Now come to the diabetic management. So naturopathy, how naturopathy sees diabetes and how we are addressing. So primarily we do the root cause analysis. We are trying to find the root cause of the disease, and then we are doing something. Considering the body as whole, we are considering body as a whole, we are not considering at one particular part, but considering body as a whole, considering microorganism present inside the body, and of course the pathogenesis of the disease. So based on that, we decide the management. And as I said, we use multiple things, multiple processes. So diet therapy is most important, then the hydro, mud, yoga, massage, manipulative therapy, fasting therapies, acupressure, acupuncture. So there are many therapy we use for the naturopathic management. Diet. So diet part is something we assess very carefully, and before even deciding something, before even guiding something, we see the body type of the person, vitality, his energy, whether energy is more or energy is less. Many times we all have a different feeling, like we feel that some people feel cold, some people feel like warm. Why? Some people like different tastes, or some people like crisp. So that all can actually give the signals, and that we are identifying, and then the deficiency. After that, we plan the dietary protocol. In diet, we majorly focus on the live food, such as fruit, vegetable, sprout, nut, soaked nut and seeds, which help to repair, nourish, and maintain the natural balance of the body. Now the hydrotherapy means water therapy. So we use water at different temperature, at various temperature, and we use we do foot bath, immersion bath, hip bath, steam, alternative compress, or pack that is called GH pack, gastrohepatic pack. There's a specific treatment for the diabetes. And scientifically study prove hydrotherapy can improve your blood circulation because of the temperature changes, the temperature difference, support detoxification, reduce stress, enhance immunity, rejuvenate cell, and promote overall vitality. Next important element in naturopathy is the mud. So we use mud directly and indirectly at the various part of the body based on the requirement. Again here, scientific study proves it's promote electronic exchange. Reduce inflammation by regulating factors, insulin growth factor and TNF alpha in the serum. Rejuvenate skin and restore metabolic balance. Increase supply, blood supply, and help toxin removal. Enhance digestion. So mud is something which we are not lucky enough, to come in contact with the mud. So here we are using specific mud for the treatment purpose, and we have seen the changes. Then the manipulative therapy, that is called the massage therapy. So in manipulative therapy, we use therapeutic steps, and there are different kind of massages. So we use specifically Swedish massages, that is therapeutic, and we use medicated oil, plain oil, sun-charged oil, various type of oil based on the requirement and based on the issues. So again here, so the manipulative therapy help stimulate lymphatic system, which helps to remove the toxins, because toxin is something which is play important role in many issues. And manipulative therapy helps in improve immune function, enhance detoxification process, reduce muscle tension, relieve stress, and improve mobility. Then the yoga therapy. We all know about the yoga. We are practicing yoga. So at Venu Naturopathy, we do therapeutic, customized yoga based on individual need. Scientific study proven it manages the stress, boosts circulation, improve flexibility, remove toxic matter from the body, and maintain hormonal balance, which is most important in the management of the diabetes. Here, as we are seeing since 2 years patients, and there are some cases I wanted to present. The gentleman, 54-year-old gentleman, by profession is advocate, and when he came first time, I consult him, and that time his HbA1c level was 10.7, along with other disturbed parameter, high parameter I would say. And then after that, after consultation, he got injured and he just left and he could not come. And then he came 1 year back. And then from there, we took him and we gave 2 weeks program. And that time his HbA1c was 6.8. And in between, he was following the dietary guidelines, which we suggested. And after that, it again came down 6.1 and 5.5. And this is happening, he is strictly following the dietary part, the yoga, the water therapies, everything he is following. And because of that, result is what we are seeing. So I wanted to say that control is absolutely possible if someone can follow the naturopathy properly. Another case of gentleman is a retired officer and 75-year-old. So he is following many things, dietary very religiously, even he follow medicines. And when he came, that time his parameter was different, and when he came to at our place it was 6.9, and after that, month of October it was 5.5. And since 4 months he is not taking any medication, he is off medication. So at this age, bringing parameters normal is not easy. But because of his effort and because of his belief, because of his dedication, we are seeing the changes and the results. So this is the strength of naturopathy. If one can follow sincerely, there is no doubt he will not get result or she will not get result. We will surely get the result. With that, I wanted to conclude this thing. Thank you so much. Thank you.
Thank you so much, sir, for your valuable information on naturopathy. I now request Brigadier Dr. Ponindra Dogra, Medical Director, Venu Eye Institute, to share with us the impact of diabetes on eye health. Dr. Dogra specializes in cataract and vitreoretinal surgery with over 24 years of experience. His contributions encompasses extensive teaching, research, and clinical expertise.
Thank you, ma'am. Thank you. As far as naturopathy is concerned, I'm a novice. Good afternoon, ladies and gentlemen. This presentation is basically an ophthalmologist's perspective towards the diabetes mellitus. Compared to naturopathy, our definition is rather simple, related to high blood glucose level. Either insulin production is inadequate or the body cells do not respond to the insulin being produced. We are all aware the insulin comes from the pancreas, and this is a photograph of the retina showing advanced diabetic retinopathy changes. So basically there are two types of diabetes. Type 1, which is less common, only 5 to 10%, autoimmune disorder where insulin is required, mainly occurring in children, and the more common type 2 diabetes, which is present in more than 90% of the population and most common in adults or even in youth. Insulin may or may not be required. Other than these two are the secondary diabetes or gestational diabetes, which refers to diabetes during pregnancy. There are much more learned people here in endocrinology who will give you a more detailed, so I will skip this. Now, regarding global burden of diabetes, why are we so worried about diabetes? Because the prevalence or the incidence of diabetes is rising exponentially, you can say. It's going to become a pandemic. If you see Southeast Asia, which comprises mostly countries of the Indian subcontinent up to Burma and Afghanistan, in 2019 we were 88 million. And after 25 or 20 years, we are going to cross 150 million. So there's going to be a 74% rise in the diabetes population. So these are the various complications in a simple form affecting the kidney, heart, nerve, feet, skin, and of course eyes, which we will talk later. And two things I wanted to tell about the low sugar hypoglycemia. What are the symptoms? Thanks to Google, shaking, sweating, anxiety, dizziness, hunger, fast heartbeat, weakness, headache, irritability are due to hypoglycemia. Hyperglycemia, you will be thirsty, passing urine frequently, dry skin, hungry, sleepy, and of course infections, more time taken to heal. Now, basic how diabetes affects the eyes. Cataract, luckily, is a reversible loss of vision. So cataract surgery, everybody is aware, is done by phacoemulsification and lens is implanted, and by and large you regain the vision unless you have diabetic retinopathy, which we'll discuss, increased intraocular pressure causing glaucoma, and various cranial nerves may be damaged or paralyzed. As far as diabetic retinopathy is concerned, you can have hemorrhage in the retina or vitreous, detachment, neovascularization or new vessels in the iris, and ultimately leading to blindness. So these are the various risk factors: poorly controlled diabetes, duration, hypertension, cholesterol, pregnancy, ethnicity, smoking. Now, why is diabetes so important for eyes? Because vision loss is the most feared complication of diabetes. In a big survey done in the US, they found that almost 50% of the population felt that loss of vision affects their day-to-day life the maximum as compared to loss of memory or limb loss or speech or hearing loss. As you can see, nearly 50% feel vision loss affects them the maximum compared to all the other losses. And there was an additional study which felt that the rate of suicide was higher when the patient lost his vision. So if the diabetic population is going to rise, obviously sight-threatening or diabetic retinopathy will also rise. So as you can see in the graph, if it goes from 463 million to 700 million, the number of people affected severely with vision problem will go from 28 to 44 million. So this requires no great maths. Why diabetes vision loss is so important is, unlike cataract, which occurs mostly in elderly group, vision loss in diabetes occurs in young group, working age group, 25 to 45 or 25 to 50 years, where the patient or the individual is most active, working, and he is unable to do his day-to-day functions, and most importantly, these people are more prone to go into depression. And depression is a cause for many other psychiatric problems. As far as diabetes is concerned, in allopathy the goal is rather simple: maintaining blood sugar levels, whether it is by prevention or by active treatment. Just a few slides on prevalence of diabetic retinopathy in India. 77 million adults and about 8.5 million having severe sight-threatening diabetic retinopathy. If you have new vessels forming in the retina, we refer to that as proliferative diabetic retinopathy. Otherwise, it is called non-PDR. This is a normal fundus, and in the center is the macula, which is responsible for our vision or for our fixation. So if the macula gets involved, there is swelling in the macula. A separate term is given, diabetic macular edema or diabetic maculopathy, because all of us want vision. So diabetic retinopathy, 1/3 of the patients with diabetic will have diabetic retinopathy, and out of these 1/3 will have sight-threatening diabetic retinopathy. An interesting fact about diabetes duration is that if you are diagnosed with diabetes today, if you are a type 1 diabetes, after 20 years, all will have diabetic retinopathy. If you are a type 2, then more than 50% will have diabetic retinopathy after 20 years. So there are various classification of diabetic retinopathy, all basically on the assumption whether you have new vessels or you don't have new vessels. And as I brought out to you, it's very important that we assess our macula, because maximum vision is in the macula. Overall also, diabetes is the sixth leading cause of blindness and number one cause of blindness in working age group. So, prevention as far as eyes is concerned, you should have annual eye examination and effective and prompt treatment. And what are the treatment options as far as diabetic retinopathy or macular edema is concerned? Good diabetic control. We have a green laser, photocoagulation of the retina by the green laser. We have various injections, anti-VEGFs, vascular endothelial growth factors which are given inside the eye. And if you are having advanced, then various types of surgery, 3-port pars plana vitrectomy. To conclude, see, there are so many variables and factors playing in diabetes, whether it is physical activity, body fat, stress, diet, weight, exercise, smoking, that this gives an opportunity to various alternative methods of medicine to try their scope also. Here, I would feel naturopathy may have a role. On the occasion of World Diabetes Days, I thank all of you for coming here and giving us a patient hearing. Thank you.
I just wanted to know why retinopathy diabetes is more common in the middle age people. I think we can take the questions together later.
Thank you, sir. And I invite Dr. Puneet Misra to talk about the role of yoga in diabetes management. He's a professor of community medicine at AIIMS. He's a public health expert with over 20 years of experience in preventive medicine, epidemiology, and research. He has served as the... Thank you.
Good afternoon, everyone, and distinguished guests on the dais, off the dais, physicians, naturopaths, ladies and gentlemen. First of all, let me thank Venu Naturopathy who invited me here for this talk. And I am really privileged in the way that I am delivering this talk when Dr. Anoop Misra is here, from whom I have learned the basics of diabetes research. When I joined AIIMS 25 years back, he was my mentor and guru. And now, since I'm a practitioner of modern medicine, I'm trained in modern medicine. But here I'll talk about little bit about the role of yoga, integrative medicine in the diabetes management. I'm not saying that we can deal entirely with the yoga to treat the diabetes, but I'll show one of the experiment, one of the study which we have done in the community-based setting. I am from the community medicine, so for me primarily it's the community is the concern, right? For me, I mean, I'm really concerned why diabetes is increasing, how to control it, why more and more people they are getting diabetes, and how to have a program for it. But before moving further, I'll start my discussion with this wisdom from the our ancient literature. Om sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashyantu, ma kasyat dukha bhaga bhavet. Om shanti shanti shanti. As you know, that diabetes burden it's increasing in the country, all over the world. I'll not go into the figures. Dr. Dogra has already presented those figures. And the thing is that if you see wherever you see about the diabetes, more than around 50% of the population remains undiagnosed. So if you are getting one case of diabetes, probably one case who is there in the community, but it's undiagnosed. India is many times called the diabetes capital of the world. We have huge number of diabetics. I'll show some of the figures in the next slide. But the more worrying thing about the diabetes in India is in the Western world, the people they get diabetes at the later stage, maybe in their 50s and 60s. While in our country now, people they are getting affected in their 30s and 40s, right? Maybe younger. So that is a cause of concern, because if they get affected early, probably they will have complications early. As Dr. Dogra has pointed out that, after certain years, majority of them, they have eye complications. Similarly, they might have some other complications related with the cardiovascular disease, related with the kidney. So this is a disease where two things are important: duration and the control. And if people they are getting disease early, many of them they might get the complications. So that is little specific for India. If you see diabetes burden, according to NFHS data, that is National Family Health Survey data, if you see blood sugar level, which was high or very high, in urban area it was 16.3, in rural 12.3, and 13.5% of the women they had this, and if you see in the male, it is slightly higher. So this is the scenario about the diabetes. That's why we are here to talk about the diabetes. But when we talk about the integrative medicine, we talk about the complementary medicine, naturopathy. What are the major Indian system of medicine? So there are many, but here I like to say that Ayurveda, Yoga, Siddha, Naturopathy, they are the main systems which many of the people they want to use along with the modern medicine. And the tradition, if you see, it goes to centuries back. And what from the Maharshi Charak, the Charak Samhita, it says those imbalance is disease, perfect balance is health. In diabetes, it's very important that you keep the right balance of the body, whether it is and the disciplined life, whether it is your diet, your physical activity, your lifestyle. That is very important along with the pharmacological treatment. So in AIIMS, if you see the logo of AIIMS, it says Sarir Madhyam Khalu Dharm Sadhanam. If we translate it, it means the body is indeed a primary instrument of dharma. So we have to keep the body, healthy, and to keep the body healthy and to have the right, the balance. There comes the role of yoga. And I'll discuss a little bit in detail about yoga, because my talk now onwards would be focused mainly on the yoga, not on Ayurveda or naturopathy. So all of you know that it comes from the Sanskrit word, means to join, to yoke, to unite. Unite with what? Unite with the universe, those energies, right? And there are different, 8 limbs of the yoga, and it is unique that it's not only the exercise, but it creates the sense of oneness with ourselves, with the world and nature. And centuries ago, our Sanskrit poet, Bharthari, praised the specialty of yoga, highlighting its significance in promoting well-being. And what this Sanskrit slok says, that regularly practicing yoga, a person can imbibe some very good qualities like courage, which protects like a father, forgiveness as possessed by mother, and mental peace, which becomes a permanent friend. Through regular practice of yoga, truth becomes our child, mercy our sister, self-control our brother, the earth becomes our bed, and knowledge satiates our hunger. And these aspects are important when you control, when you talk about the diabetes and control of diabetes. Many times people say that, okay, there is no evidence that it can really control the diabetes. Since I'm a practitioner of modern medicine, and it is very important for us that whatsoever there is evidence based, only that thing we accept. For that, in AIIMS, a few years back, how my research on the yoga started, we have started a center for integrative medicine and research. And it was started around 9 years back. The reason for establishing this center was to have the evidence in these methods, and if there is evidence for any therapy or any method, then it can be incorporated with the modern medicine. So that's how this center was established. And there are certain physiological basis here. I mean, how through the nervous system, hormones, and how does it modulates your body system. how it modulates your immune system, behavioral changes, and in yoga and naturopathy interventions, how can we get rid of some of the diseases, including the diabetes. If we cannot completely reverse, at least we can control. Although there are studies where they say, okay, it can be reversed, especially those who are in the pre-diabetic stage. They can go back to the normal stage with the incorporating these practices. So there's again, this is the diagram to show what is the mechanism of yoga for diabetes management. So I mean, there's some evidence and some studies which suggest yes that diabetes it might have a role. Yoga might have a role in the diabetes, and it may be a different level of prevention. In medical science, we talk about the primary prevention, secondary prevention, tertiary prevention. At all the steps, diabetes in the diabetes, yoga can have a role. So now here we know that diabetes, yoga can have a role, and we don't have that much literature. So when this Center for Integrative Medicine has come to AIIMS, then we decided that we should conduct some study. What happens in yoga, in my mind, what I was thinking at the time, if we call people to the yoga studio in AIIMS and prove that it is working, and then they go back, probably it would not be sustainable. Yoga is something like that, you have to practice it, for your life, and it's not that you do once and then you're cured and it's done. No. So I thought, okay, let me do it in a setting where people, it can be sustainable. The other question was in my mind that 60-70% of the population, maybe 80% of the population in the country, they cannot afford any yoga teacher. They cannot afford any setup where they can do yoga. So I thought, okay, let me do in a setup where most of the people they can, do in their own atmosphere. So I will be showing that clinic where we have done this in the setting. So with this, AIIMS has launched a program to see effect of a structured yoga program on diabetes, stress, wellness in the community setting. Why I call it as a structured yoga program? Because if I say, okay, yoga is beneficial to the diabetes, then you'll say, okay, what yoga? So many yoga postures, there are 8 limbs of yoga, so what yoga are talking about? Because in modern medicine, how we are trained that, okay, if we give this drug in this dose for so many days, this will be decrease in blood pressure, this will be decrease in the blood glucose level, that's how we are trained. So, our mind works that way. So we developed a structured yoga program, which I will be discussing in little detail. And I have already discussed what are when you go to the community challenges, yoga, there are no yoga facilities or, sustainability is problem, then the timings is a problem, how to get it done. And with all these things, we thought, what can be the solutions for this when we went to community? Yoga at the doorstep, we did this program in the community setting, not in any yoga studio or any, specialized setting. Then there was supervised training, which was there for 3 months. Then community engagement, we engaged the volunteers from the community, and peer group we have made, and I think this was done before COVID, by 2020-21. Most of things were done, and still the practice is going on to that community. Home visits were there, and bringing community together to celebrate each and every event. So coming to the study site location, so this is the site location. This is the AIIMS as a urban health center in Dakshinpuri colony, which is a resettlement colony. It's a kind of a slum area. So this project was done at Dakshinpuri area. Some of the pictures from Dakshinpuri area to give you the idea of the area where it was done. And this was actually the center where we have this center, but we have done in this locality. Some of the pictures from the locality where we have done this program. So what we have done? This was an intervention study. In intervention study, we take a group where we do intervention. Intervention can be anything. It can be like you are giving drug. Here my intervention was the structured yoga program. There was a yoga module which we have we prepared with the help of SVS in Bangalore and CIMR at New Delhi. So with the yoga specialist from SVS and CIMR, they have prepared this module, and we have taken individuals whose SB1C was more than 6.5, and their different skills we have used, and their biochemical parameters, they were taken at 3, 6 and 12 months. So intensive training was given at the Urban Health Center for 2 weeks, as per the program, and they were trained to undergo these yoga exercises at home at least 5 times a week. What we did, that our healthcare workers, they visited all those houses at least twice a week to make sure that they are actually doing yoga, and if they require any help, it was done. The reason for asking them to do yoga at their home or at the park is that so that it can be sustainable. We never wanted them to come again and do, otherwise they will. So even if they have a one-room house, they were doing it there in the either in the parks or in the nearby temple. We have spoken with the school authorities as well to provide them a space when when school is not before and after school hours. So that worked as well. There were 50 minutes module which we have prepared. So this was a 50-minute module, and we had the highest level of commitment from AIIMS. This program was inaugurated by the then director Dr. Guleria and in the presence of Dr. Nikhil Tandon, head of Department of Endocrinology, Dr. Gautam Sharma, who is heading Center for Integrative Medicine Research, and this event was done in the community, and then we have done this research. We have prepared a module, and this booklet was given to each and every individual who was there enrolled for this program. These photographs are not from the community. These are from the yoga studio where our yoga therapist got trained at AIIMS in the CIMR facility. These are the real pictures where the intervention pictures, those who were enrolled and they have done yoga. All the pictures they have taken here shown with the consent of the people who are here in this picture. So this is like Basti. They have done the sessions, some of the photographs. Then we have taken the adjacent park, we have taken the mandir, so to make it sustainable. This is the office, all the blood work and everything was done there, and blood. These were the house to house visit. You can see the kind of locality it was, and so coming to the total, the participants who were given intervention, there were 209, and in the wait list control 192. Meaning, why we said wait listed control, that we haven't denied the yoga to anyone, but what we said, okay, we will give this yoga to you after the intervention is done. And what we have found that there was, after 3 months, there was a significant difference in the fasting blood glucose level, HbA1c level, cholesterol level, and LDL level among those who have in the intervention group of this. So we did intervention to show the plan was to continue it for 1 year, but all of them, they could not participate for 1 year, the reason being COVID. So some of them, they have completed 6 months, some of them completed 12 months. We did analysis for 3 months for each and every individual. These are the results for 6 months as well, and the results, they were really encouraging. So in a community setting, if you do an intervention study, and which we did here for 50-minute regular yoga, it has significant effect in HbA1c level, and it can be a low-cost strategy and complementary strategy to control hyperglycemia and lipid levels, and can help better control type 2 diabetes in the community setting. So that was our purpose, and we have shown this study has been published in International Journal of Yoga and available in the public domain now. So with this, I will end my talk. Thank you for your listening, and here are some pictures from the International Yoga Day which I attended at United Nations when Modi ji was there, and they set a world record. People from more than 154 countries, they did yoga on a single day. Thank you very much for your listening, and I will be happy to answer any question. Thank you.
Thank you so much, sir, for enlightening us with the value of yoga for diabetes. I now request Dr. Anoop Misra, sir, to share his expertise on diabetes management. He is the Executive Chairman of Fortis Hospital for Diabetes and Allied Sciences, a prominent figure in diabetes research. Dr. Misra also leads the Director of National Diabetes Obesity Cholesterol Foundation and President of the Diabetes Foundation. Previously, he served as a Professor of Medicine at AIIMS, New Delhi, and is a globally recognized expert with over 367 published research papers, and Stanford University ranks him in the top 2% of diabetes scientists worldwide. His groundbreaking work in includes establishing obesity definitions tailored to the Indian population. With 48,328 citations, his influence in the field is profound. Currently, he is Editor-in-Chief Diabetes and Metabolic Syndrome and serves on the advisory board of the BMJ and Lancet Commission on Obesity. Dr. Misra received the Padma Shri in 2007 and Dr. B.C. Roy Award in 2006 for his contributions to medicine. He has also authored the book Diabetes with Delight.
Thank you. Sonal Mansingh ji, Sujaya Krishnan ji, Puneet, who's done wonderful studies, and he's one of the brightest boys amongst our group. It's a great show, Puneet. Tanuja, thank you for all the help. Maya, thank you for that hamper. Dr. Talwar for introducing diabetes so well. I don't try to do anything much as far as basic information is concerned. And in particular, Kamhani Saab, who's instrumental in bringing me here at this time. So I would like to give you a big hand. तो पहले तो मैं आपको बता दूं, मैं हिंदी बोलूंगा काफी। पहले तो बता दूं मैं आपको कि मैं कोई टेक्निकल बात ज़्यादा नहीं करने वाला हूँ, बहुत सिंपल बात करने वाला हूँ, और ना मैं इंट्रोडक्शन देने वाला हूँ कि टाइप 1 डायबिटीज, टाइप 2 डायबिटीज ऑलरेडी बीन इंट्रोड्यूस, और जो भी मैं बोलूँगा वो मोस्टली टाइप 2 डायबिटीज के। टाइप 1 एक अलग ही चीज़ है, उसके बारे में हमको बोलना उचित भी नहीं मैं समझता इस समय, क्योंकि ज़्यादातर यहाँ पर लोग अगर किसी को डायबिटीज है तो टाइप 2 डायबिटीज। दूसरी चीज अब फ्रंट में आपको बता दूं कि 1980 में जब मॉडर्न इंस्टीट्यूट में था एज अ स्टूडेंट, तो उस समय हमारे पास 2 दवाएं थी और 2 इंसुलिन थी। आज 10 दवाएं हैं, 10 इंसुलिन हैं और इंजेक्शंस हैं। एडवांस, मार्केटली एडवांस, डायबिटीज की नॉलेज इतनी एडवांस हो गई है कि हम भी पेश नहीं कर पाते हैं, रोज हम पढ़ते हैं फिर भी पेश नहीं कर पाते हैं। लेकिन वो सब चीजें मैं बताने वाला नहीं हूँ, क्योंकि मैं जाता हूँ सारा जज कर रहा हूँ, यहाँ का नेचर फ्रेंडली मूड है, और जो मैं कहूँगा वो एविडेंस बेस है, जो कि हमने भी रिसर्च किया है और लोगों ने भी रिसर्च किया है। देखिए, एक चीज हमको बचानी है, वो है एज। एज हम फास्टर ना हो, ये हमारा एम होता है। एज फास्टर होगी सारी डिजीजेस आएंगी, और डायबिटीज इज वन ऑफ द डिजीज व्हिच मेक्स यू एज फास्टर। तो कुछ लोग, कुछ रेसेस, इंडियन रेसेस एज फास्टर, हमको ये बचाना है। अब ये देखिए, ये क्रोमोसोम है, ये सेल है, ये क्रोमोसोम है, और इसके एंड में यहाँ पर एक टेलोमेयर नाम की चीज होती है, और वो शुरू में देखते बड़ी होती है, फिर धीरे धीरे स्ट्रेंथ होती जाती है, वो हाथ की लाइन की तरह। जिसकी लाइन छोटी उसकी कीमत छोटी। ये टेलोमेयर अगर छोटे हो जाते हैं तो इसका मतलब आपकी लाइफ छोटी हो गई है। तो ये चीज हमने रिसर्च करी है, पेपर कोने में छोटा सा पड़ा हुआ। हमने रिसर्च करी है कि जो जिनको प्री डायबिटीज हो गई, प्री डायबिटीज क्या है मैं अभी बताऊंगा, उनकी एज सीधे नीचे हो गई, टेलोमेयर छोटे हो गए। तो हमको तो प्री डायबिटीज से भी पहुंचा, डायबिटीज की बात अलग ही है। जब डायबिटीज हो तो हमको बहुत ही अच्छी तरह से उसको कंट्रोल करना है। तो क्या है डायबिटीज, एक बेसिक चीज क्या है, क्योंकि आप लोग इतना सोचते हो सुनते हो, लेकिन उसकी परिभाषा क्या है? परिभाषा ये है, जो नॉर्मल, अगर आप कभी लैब में जाएं और अपना ब्लड टेस्ट कराएं, फास्टिंग ग्लूकोज अगर आप 95 है तो आपका नॉर्मल है, 100 से नीचे है, और आइडियली आपको ग्लूकोज पीने के 2 घंटे बाद भी टेस्ट कराना चाहिए, क्योंकि इंडियंस में वो बाद का टेस्ट ज्यादा, कभी नॉर्मल होता है फास्टिंग तो कहेंगे अरे हम तो ठीक है भाई, अब बाद का ग्लूकोज बढ़ा होता है तो वो 140 से नीचे होना चाहिए। और डायबिटीज की परिभाषा क्या है कि फास्टिंग शुगर 126 से ऊपर हो और 2 घंटे का 200 से ऊपर हो। तो बीच के कुछ अंक रह गए, 100 और 125 के बीच में रह गया फास्टिंग, और 140 और 200 के बीच में रह गया, वो प्री डायबिटीज है। प्री डायबिटीज की क्या महत्व क्या है? महत्व यह है कि अगर किसी को प्री डायबिटीज हो तो हम उसको नीचे लाकर रिवर्स कर सकते हैं, उसको डायबिटीज होने नहीं दे सकते, क्योंकि प्री डायबिटीज आपसे मैंने कहा एज ऑलरेडी आगे चली गई। तो हमको ये करना जरूरी है। वही चीज बताई जा रही है आपको और भाषणों से, और पुनीत ने जो कहा कि हम कैसे उसको कम कर सकते हैं। अब लोग कहते हैं कि क्यों भाई हम क्यों जाएं किसी के टेस्ट कराने ही क्यों जाएं, हम तो ठीक महसूस कर रहे हैं, लेकिन अंदर क्या हो रहा है आपको पता नहीं चलेगा, ना मुझको भी नहीं पता चलेगा, इतने साल का एक्सपीरियंस है नहीं पता चलेगा। तो कोई साइंस हो सकता है हो ही ना, और 50% लोगों में करीब कोई कुछ नहीं पता, कोई साइंस नहीं, हेल एंड हार्टी, उनको टेस्ट किया तो पता डायबिटीज निकली। और ये देखिए एक मैंने एक उदाहरण लिया है कि इसका पैर ही खराब हो गया तब हमने शुगर टेस्ट किया तो 300 पर शुगर निकली, उसको पता ही नहीं था जब तक उसका पैर में घाव ना हो गया, तो उसको डायबिटिक फुट कहते हैं। और तो कॉम्प्लिकेशन हो सकती है जब आप डायग्नोसिस हो, ऑलरेडी टाइप 2 डायबिटीज में ये बड़ी प्रॉब्लम है कि जैसे डायग्नोसिस हुई उसी समय कॉम्प्लिकेशन कुछ समझ में हमको देख रहे हैं, कभी कभी डायबिटिक रेटिनोपैथी भी दिखती है हमको। और हार्ट डिजीज ऑलरेडी प्री डायबिटीज में 2 से 4 टाइम, और जैसे ही डायबिटीज डायग्नोस हो 4 to 8 टाइम। तो कई लोग कहते हैं साहब हम हार्ट का चेकअप क्यों कराएं, क्योंकि आप ऑलरेडी रिस्क पर हैं। हम हार्ट के लिए कोई दवा क्यों लें, क्योंकि आपका आगे जाकर हार्ट अटैक हो सकता है अगर केवल डायबिटीज की दवा लें। तो ये देखिए एक बहुत बड़ी बहुत डायबिटीज की सोच में अंतर आ गया है 20 साल में। क्या अंतर आया है? पहले हम शुगर बस कंट्रोल करते थे, हाँ शुगर कंट्रोल हो गई आप जाइए 6 महीने बाद आइएगा। अब क्या कहते हैं, आपका ऑर्गन ठीक है, आपका हार्ट ठीक है, आपकी किडनी ठीक है, तभी आपका कंट्रोल ठीक है, वरना शुगर कंट्रोल होने से केवल बात नहीं बनेगी। तो किसको स्क्रीन करा जाए? आप में से कई डायबिटिक होंगे या कोई नहीं भी होंगे, आपके बच्चे या कोई और संबंधी, किसी को स्क्रीन किससे किया जाए? आजकल बड़ी ही हम स्ट्रिक्ट परिभाषा पर चलते हैं, और हमने सजेस्ट किया गवर्नमेंट ऑफ इंडिया को कि ये भी स्क्रीनिंग आपको चेंज कर दी जाए। जैसे कि हम आजकल गवर्नमेंट ऑफ इंडिया की स्क्रीनिंग एज है 30 साल, सब लोग 30 साल, और मुझको बहुत कम लोग 30 साल से कम नजर यहाँ पर आ रहे हैं। आप सब लोग को डायबिटीज का चेकअप कराना चाहिए। और बीएमआई बॉडी मास इंडेक्स, यानी जिसको कि केजी में और मीटर स्क्वायर का एक रेशियो होता है, अगर 23 से ऊपर है, बड़ा आसान है कैलकुलेट करना। इसके सारे आप अपने उसमें मोबाइल में आप कैलकुलेट कर सकते हैं, इसकी वो है एल्गोरिथम है, तो आप उसको कैलकुलेट कर सकते हैं। तो ये तो एज मोर देन 30 है, लेकिन एज अगर 30 से नीचे है तो किसको कौन लोग करें? जिनकी फैमिली में डायबिटिक हो। जो 20 साल का कोई लड़का है, ओवरवेट है, और उसके माता पिता को डायबिटीज है, वेस्ट सर्कमफ्रेंस पेट का घेरा ज्यादा है, जो फिजिकली इनएक्टिव है, फीमेल्स हु गिव बर्थ टू बेबी मोर देन 4 kg, दिस इज इंपॉर्टेंट, तो उसको उनको डायबिटीज की संभावना ज्यादा होती है। और जिनको ब्लड प्रेशर हो, जिनको कोलेस्ट्रॉल की प्रॉब्लम हो, हिस्ट्री ऑफ हार्ट अटैक एंड स्ट्रोक हो, रिकरेंट इन्फेक्शंस वगैरह हो, इन सबको जरूरत होती है यंग अवस्था में भी। तो 25 साल की अवस्था में हम कह रहे हैं कि सबको टेस्ट कराना चाहिए, गवर्नमेंट ऑफ इंडिया कह रही है 30 साल की अवस्था में। तो हम थोड़ा सा ज्यादा एग्रेसिव है, क्योंकि हम देख रहे हैं आजकल यंग बच्चों में, यंग लोगों में डायबिटीज बहुत ज्यादा हो रही है। अब क्या आप लोग बिना टेस्ट किए पहचान सकते हैं कौन रिस्क है? तो एक तो पहचान सकते हैं जो लोग मोटे हों, उनको पहचान सकते हैं, वो रिस्क पर है। पर कुछ और भी चीजें हैं जो आप देख सकते हैं। ये देखिए, ये गर्दन के पीछे काला दाग, इसको कहते हैं अकांथोसिस निग्रिकेंस। ये जिसको हो, आप किसी के पीछे बैठे हो, आगे आप देख सकते हैं अभी भी। मैं तो सब लेक्चर लेता हूँ, कहता हूँ भाई आप दूसरे की गर्दन देखिए। अकांथोसिस निग्रिकेंस जो भी हो, उसको इंसुलिन रेजिस्टेंस, आपने टर्म सुना होगा वो नेचुरोपैथी के लेक्चर में, और डायबिटीज हो सकती है। बफलो हम्प, इसको जैसे बफलो का एक वो कुबड़ होता है ना, वैसे ही हम्प पीछे किसी के ज्यादा मांस हो, वो ये देखें। और जिनके यहाँ पर मांस लटका हो, कुछ तो एज के साथ होता है तो वो दूसरी बात है, लेकिन यंग लोगों में अगर है, ये देखिए रादर यंग पर्सन, उसका देखिए यहाँ पर मांस, और जिसका कि यहाँ पर मांस ज्यादा हो इधर। अब हम उसको कैलिबर से नोट करते हैं, लेकिन आप वैसे भी देख सकते हैं, पिंच करके देख सकते हैं। और जो डॉक्टर देखते हैं कि लिवर, अब लिवर की बात भी मैं बताऊंगा, क्योंकि वो सबसे जरूरी अंग है जो शुगर को कंट्रोल करता है, लिवर बढ़ा हुआ है जिसका। तो ये चीजें, इसमें से ये और ये शायद आप ना कर पाए, लेकिन ये सब आप देख सकते हैं। अब ये मेरे बुक है डायबिटीज डिलाइट जिसका मेंशन हुआ है, इसमें हमने कैरेक्टरिस्टिक लिखी है कि हम यंग लोगों में डायबिटीज देखते हैं एज कंपेयर टू अदर वर्ल्ड पॉपुलेशन, और डिलेड डायग्नोसिस कॉमन है, और हमारा बॉडी में फैट बहुत ज्यादा है, पेट का घेरा बहुत ज्यादा है, और फैटी लिवर है हमारे, ऑल्सो मसल मास कम है हमारा, और ज्यादा हार्ट डिजीज और ज्यादा किडनी डिजीज होती है हमारी पॉपुलेशन में, और पॉपुलेशन से ज्यादा मैं ये बात कर रहा हूं एज कंपेयर टू व्हाइट्स, एज कंपेयर टू ब्लैक्स। ये सब कारण हैं कि हमारे में डायबिटीज ज्यादा है और उसकी कॉम्प्लिकेशंस ज्यादा है, और उसके कारण हम डिबेट कर सकते हैं, लेकिन मैं जानना नहीं चाहता उस डिबेट्स में कि हमारे जीन्स खराब हैं या हम अडॉप्ट नहीं कर पा रहे हैं, ये नई न्यू फाउंड वेल्थ का और न्यू फाउंड ज्यादा खाने का और फास्ट फूड का हम नहीं अडॉप्ट कर, हमारी बॉडी नहीं, हमारी बॉडी वही फेमिनिन मोड में है, जो हम अकाल पड़ा था, हमको खाना नहीं मिला था, उसी मोड में है हमारी बॉडी अभी तक, और स्ट्रेस से भी अडॉप्ट नहीं। हम तो एक कोने में रहने वाले, गांव में रहने वाले लोग, वो स्ट्रेस से कहाँ अडॉप्ट कर रहे हैं? ये तो 100 साल से ये सारी चीजें आई हैं, और 100 साल से ही डायबिटीज बढ़ी है। बाकी हमारा उसी कारण न्यूट्रिशन, फिजिकल एक्टिविटी और हमारा नॉन कंप्लायंस, भाई अब जो है भगवान करेगा, वो एटीट्यूड हम रोज देखते हैं, रोज हर पेशेंट में देखते हैं। अब देखिए, सबसे ज्यादा पेट का घेरा, हमें कहना है कि हमारी सिक्योरिटी और होनी चाहिए, हमारा बहुत खतरा है, लेकिन सिक्योरिटी बेल्ट वाले लोग जो हैं तो खुद ही, देखिए इनके बेल्ट के पीछे देखना है हमको ऊपर नहीं देखना। ये देखिए, ये क्या है? लिवर का एक सेक्शन है, और ये इनके लिवर का सेक्शन है। ये डर्टी लग रहा है, खराब लग रहा है, और ये भी डर्टी है। तो जो फैट इन द लिवर है वो की है, डायबिटीज का की है, हार्ट डिजीज का की है। और अगर आप देखें फर्दर इसमें थोड़ा सा और ध्यान दें तो ये देखिए नॉर्मल लिवर है, और इसका अगर हम लंबाई नापें, लंबाई कैसे नापते हैं? कोई इंच टेप से नहीं नापते, अल्ट्रासाउंड से नापते हैं। तो ये लंबाई नापी हमने 11 सेंटीमीटर है, और ये है फैटी लिवर, मेजरली फैटी लिवर। इसकी लंबाई 22 सेंटीमीटर है, 20 सेंटीमीटर। और देखिए ये लिवर अंदर फैट रख करके कोलेस्ट्रॉल बना रहा है, शुगर बना रहा है, और ऐसे तत्व बना रहा है जो हार्ट की आर्टरीज को खराब कर देंगे। और वो कैसे खराब होगी? वो ये जो तत्व बना रहा है ये, और आप पीछे जाएं, अगर इसके पीछे जाएं, जो हमने बेल्ट की बात करी, यहां पर इन्फ्लेमेशन हो रहा है, जैसे आग लगी हुई है, आग। तो ये आग क्या करती है? इसको इन्फ्लेमेशन कहते हैं, लो ग्रेड इन्फ्लेमेशन। तो ये आग जो है, इसको बहुत पहले 15 साल पहले टाइम ने कवर पर ये स्टडी वो करी थी, सीक्रेट किलर है ये आग। ये आर्टरीज में लगी। ये आर्टरी क्या होनी चाहिए? एक प्लास्टिक ट्यूब की तरह होनी चाहिए, अंदर बिल्कुल क्लीन होना चाहिए, आपको सफेद दिखना चाहिए, क्लीन जैसे प्लास्टिक ट्यूब होता है। और यहाँ पर तो सीवर की तरह आर्टरी है जिसके अंदर आग लगी है, इन्फ्लेमेशन लगा है। ये लिवर से भी जा रहा है और हमारे फैट से भी जा रहा है, बॉडी के फैट। अब ये देखिए, ये है फैट के सेल्स, ये फैट के सेल्स। लेकिन जहां आपको देखना चाहिए जो कि खराब वो है, वो ये 3 जगह, ये देखिए, यहाँ पर इन्फ्लेमेशन, यहाँ पर इन्फ्लेमेशन, यहाँ पर इन्फ्लेमेशन। अंदर आग जो लगी है वो सारे सिस्टम को खराब कर देगी। डायबिटीज की बात नहीं कर रहा मैं, आपके ब्रेन को भी खराब कर देगी। तो हार्डर यू हिट इनिशियली, द बेटर विल बी शेप एंड फंक्शन ऑफ। लोग कहते हैं साहब हमको मौका दीजिए, हम 6 महीने बाद आएंगे आपके पास। मैं कहता हूं नहीं यार, जो करना है अभी करना है। आपको डाइट, एक्सरसाइज या अगर दवा की जरूरत है, सब चीज अभी करनी है, क्योंकि बॉडी पर रिमेंबर करेगी। आपने अच्छा किया तो रिमेंबर करेगी, और नहीं अच्छा किया वो भी रिमेंबर करेगी। तो देखिए, ये है A1C, और ये सालों साल बीत गए, कभी नीचे गया, कभी ऊपर गया, कभी नीचे गया। और हमने पहले एक गोली दी, पहले डाइट लाइफस्टाइल करी, फिर एक गोली दी, फिर दूसरी गोली दी, फिर तीसरी गोली दी। और होना क्या चाहिए? ये देखिए, ये होना चाहिए कि राइट फ्रंट में हमने हिट किया और सारी ये फ्लक्चुएशंस को बचा दिया ओवर द इयर्स। और उसमें जो आप बात सुन रहे हैं, गुड लाइफस्टाइल, डाइट एंड एक्सरसाइज आर द मस्ट एट एवरी लेवल। चाहे जितनी भी दवाएं हो, चाहे जितनी इंसुलिन हो। Food builds what you are, but food also destroys what you are. This is very important. Food is a culprit for most of the things that we are seeing today. So look at this cartoon. I am on a low carb diet. Whenever I feel low, I eat carbs. This is the usual thing these days. So Indian body type में क्या होना चाहिए? Diet, decreased quality of carbs, which has been already told. Use of complex carbs. So सारे कार्ब खराब नहीं हैं. Complex carbs. गेहूं के साथ कुछ और मिला देना. Increase protein, very important, because हमारा प्रोटीन इंटेक भी कम है, हमारी मसल भी कमजोर है. और मोनोअनसैचुरेटेड फैटी एसिड में एक मिनट में बात करूंगा. पॉलीअनसैचुरेटेड फैटी एसिड, सैचुरेटेड फैट and trans fatty acid. These are various kind of fat. These are two good kind of fat. These are two bad kind of fat. And application of lifestyle measure earlier in life. अगर आप समझते हैं कि आपके बच्चे थोड़े मोटे हैं और अच्छा आप कहते हैं वो चबी हैं, भाई कोई प्रॉब्लम नहीं, चबी होना चाहिए, उनको नॉर्मल वेट होना चाहिए अर्लियर लाइफ से, क्योंकि वहीं से शुरू होता है ये सारा कुछ. ये मत समझिए कि आप 25 साल में सब चीज रिवर्स कर देंगे जो चीज हो चुकी है. मोर एग्रेसिव इन्फ्लेमेशन, लोअर बीएमआई, हमको वेट लोअर रखना है. लोग कहते हैं आप तो कमजोर हो गए साहब, आपका वेट कम हो गया, वो नॉर्मल वेट पर है, हाँ आपका वेट कम हो गया. सब लोग कहते हैं कमजोर हो गया. मैंने कहा नहीं, आप ठीक हैं, आपकी पावर अंदर होनी चाहिए. आपने एथलीट देखा है जो लॉन्ग डिस्टेंस रनर बिल्कुल पतले दुबले, आप कहेंगे वो मालन्यूट्रिशन. इंडिया में वो कह रहे हैं कि आप तो बिल्कुल सब मर रहे हैं. नहीं, दे आर वेरी स्ट्रॉन्ग पीपल. और तो ये सारी चीजें हमको बहुत देखनी है. अब कौन सी डाइट अफेक्ट करती एजिंग को, वो एक अलग चैप्टर है, अलग एक मैं लेक्चर लेता हूँ एजिंग के बारे में अलग. वो मैं एक स्लाइड निकाली है मैंने कि हाई ग्लाइसेमिक इंडेक्स डाइट, जैसे कि कार्ब्स हैं, और जो लो ग्लाइसेमिक इंडेक्स बेसन हो जाता है, लो ग्लाइसेमिक इंडेक्स रॉ कैरेट, किडनी बीन्स, बहुत सारी चीजें होती हैं, तो उसको बचा. ये लो ग्लाइसेमिक है और कार्ब्स हाई ग्लाइसेमिक. प्रोटीन प्रेफरेंस फॉर प्लांट बेस्ड प्रोटीन. सैचुरेटेड फैट, पामेटेड जो पाम ऑयल में है, मीट्स में है, चीज में है, बटर में है, मार्जरीन. और लोग बड़े यहाँ पर हम मुझसे क्वेश्चन पर करेंगे और मुझसे नेट पर लड़ते हैं, साहब आपने घी को क्या कह दिया. घी इंपॉर्टेंट, that you should have very little ghee. अगर सब बच्चे को तो घी देना ही चाहिए. मैंने कहा नहीं, बच्चे को नहीं देना चाहिए. और कैलोरी रिस्ट्रिक्शन एक ये जो ओकिनावा को जानते हैं? कई लोग सिर हिला रहे हैं, इसका मतलब कई लोगों को पता है. ओकिनावा आइलैंड है जो जापान में है. वहां पर जो करीब 40% लोग 100 साल से ऊपर जीते हैं. उनका सिंपल डाइटरी प्रिंसिपल क्या है? डाइटरी कैलोरी रिस्ट्रिक्शन. जितना खाना चाहिए उसमें से 80% खाओ, 20% हटा दो. दैट इज ओकिनावा प्रिंसिपल ऑफ डाइट. अब देखिए, अगर हम सैचुरेटेड फैट की बात कर रहे हैं, घी का, कोकोनट ऑयल की बात कर रहे हैं जो हमारे कंट्री में प्रचलित है, उसको रिप्लेस कर दें किस चीज से? अगर हम ट्रांस फैट से रिप्लेस कर दें तो ट्रांस फैट सबसे खराब है, हार्ट डिजीज बढ़ जाएगी. अगर मोनोअनसैचुरेटेड से इन्फेक्ट करें तो कम हो जाएगा. इसका मतलब सैचुरेटेड फैट मोनोअनसैचुरेटेड फैट से खराब है. और इसी तरह से पॉलीअनसैचुरेटेड फैट, और इसी तरह से कॉम्प्लेक्स कार्बोहाइड्रेट यहाँ पर. तो क्या है ये? देखिए, मोनोअनसैचुरेटेड फैट क्या है? कनोला, ओलिव, पिस्ताचियो, आमंड, वॉलनट, सीसेम सीड, एवोकाडो. कुछ आपको अवेलेबल है, कुछ नहीं होंगे. जो भी अवेलेबल है आप कर लीजिए. ये सबसे बढ़िया फैट है. और पॉलीअनसैचुरेटेड फैट, वॉलनट, सोयाबीन, सीसेम, पीनट, सनफ्लावर, राइस ब्रान ऑयल, सामंड जो फिश खाते हैं, और फ्लैक्सीड. और कॉम्प्लेक्स कार्ब क्या है? जो हमारे पुराने हैं, जो जिसके बारे में बात हो रही है. व्हीट भी कॉम्प्लेक्स कार्ब एक तरह से है, लेकिन उसमें मिला दीजिए जौ और मिलेट्स, बाजरा, सब मिलेट्स अच्छे नहीं है, और सोरगम, ज्वार. तो ये देखिए कम हो गई हार्ट डिजीज, ये कम हो गई हार्ट डिजीज, ये कम हो गई, यहाँ पर बढ़ गई. और कार्बोहाइड्रेट रिफाइंड आप लेंगे तो बढ़ जाएगी. और अगर प्रोटीन लेंगे, प्रोटीन हमारी ये स्टडी है, मैं इसमें डिटेल में नहीं जाना चाहता, बट मैं आपको इतना बताना चाहता हूं कि जब प्रोटीन को हमने ज्यादा कर दिया तो ये वेट कम हो गया, बॉडी फैट कम हो गया, वेस्ट सर्कमफ्रेंस कम हो गया, इन्फ्लेमेशन कम हो गया बॉडी में. बैरियर्स क्या हैं? आई हैव अर्ज टू एक्सरसाइज, थैंक गुडनेस इट पास्ट। रोज मैं बहाने सुनता हूँ एक्सरसाइज ना करने के, फिजिकल एक्टिविटी पेनफुल है, आई मैं हिडन, बट कुछ बहाने तो ठीक, बहाने नहीं है, कुछ चीजें ठीक हैं। मुजफ्फरनगर से एक पेशेंट आया था, वो कह रहा था कि साहब हम किडनैप हमको कर लिया जाएगा अगर मैं बाहर जाऊंगा। टू मनी मॉस्किटोज, डॉग्स, ये भी सही बात है। साइड इफेक्ट्स है नहीं, दिल्ली में भी नहीं है। आई एम टू टायर्ड, यू टू टायर्ड बिकॉज यू आर अनफिट। इफ यू वॉक यू बिकम फिट। ये बहुत साल पहले का है। हमको 7 दिन, एक भी दिन हमको छोड़ना नहीं, हमको और वाइट से ज्यादा एक्सरसाइज। 2013 में हमने फिजिकल एक्टिविटी गाइडलाइन इंडिया की बनाई थी, उसमें हमने कहा था हमको कम नहीं, हमको और रेसेस से ज्यादा एक्सरसाइज, जो WHO ने कहा है उससे डबल हमको एक्सरसाइज करनी है, क्योंकि हमारी बॉडी अदरवाइज दे विल डिट्यूरेट। अब 10 साल जब बीत जाते हैं तो आप लोग कहते हैं साहब आप तो क्या डाइट का क्या रोल है और एक्सरसाइज का क्या, हम तो दवाई पर आएंगे और इंसुलिन हमको नीडेड है, ये देखिए सारी कॉम्प्लिकेशंस भी हो रही हैं, आंखें भी खराब हो रही हैं। लेकिन अब मैंने लास्ट में देखिए लिखा है बैलेंस डाइट एंड फिजिकल एक्टिविटी द एज इंपॉर्टेंट एज ड्रग्स एंड इंसुलिन। दिस स्लाइड आई हैव केप्ट टू एम्फसाइज दैट ईच स्टेज these आर द मोस्ट इंपॉर्टेंट थिंग्स। और दवाओं के बारे में बात नहीं करना चाहता, लेकिन ये वंडर ड्रग है जो कि हम आपको बता रहे हैं, वर्ल्ड वाइड ब्लॉकबस्टर ड्रग है जिसको हम रोज यूज करते हैं, और वो बनी है जिला मॉन्स्टर से। ये देखिए एक छिपकली है जो कि वहां पर पाई जाती है अमेरिका में, जी बड़ी छिपकली, बहुत बड़ी, और इसमें से निकाल कर तत्व उन्होंने ड्रग बना दी, अब तो सिंथेटिक बना रहे हैं। ये ओज़ेम्पिक के नाम से पूरे दुनिया में जानी जाती है आजकल, जो कि ना कहीं शुगर भी कम करे, वेट भी कम करे, लिवर को बेहतर करे, किडनी को बेहतर करे और हार्ट को बचाए। 5 कोई और ऐसी चीज नहीं बनी आज तक जो कि इसका मुकाबला कर सके। अब ये लास्ट स्लाइड है और मैं प्रिवेंशन की बात अब से कर ही रहा था, और ये फाइनल उसमें है कि हमारे माता पिता के जो जीन्स हैं उसको तो हम बदल नहीं सकते, अनलेस वी आर टर्मिनेटर एंड गो बैक इन टाइम। तो हम जीन्स बदलें, नहीं ऐसा तो हो नहीं सकता। तो जीन्स वेरी डिफिकल्ट टू फाइट, जीन्स यू हैव टू फाइट इट हार्ड। एंड सम ऑफ द रिसेंट स्टडीज, कुछ नीचे स्टडीज हैं कि जो लोग जेनेटिकली प्रिडिस्पोज है, दोनों पेरेंट डायबिटिक हैं, वो भी उसको अवॉइड कर सकते हैं विद ग्रेट डिफिकल्टी बट विद ग्रेट एफर्ट। बॉडी फैट हाई है, फिजिकल एक्टिविटी, बैलेंस्ड न्यूट्रिशन, पेट का घेरा ज्यादा है, फिजिकल एक्टिविटी, लिमिट कैलोरीज, हाई फाइबर, हाई ओमेगा 3, मैंने बात नहीं करी, पूरी बात संभव ही नहीं है। ओमेगा 3 बहुत इंपॉर्टेंट है, मुफा के बारे में मैंने बताया, और प्रोटीन, एक मील रिप्लेस भी हम कर देते हैं प्रोटीन से, वो भी बहुत अच्छी बात है। लिवर फैट, लो कार्ब डाइट, हाई ओमेगा 3 फैट डाइट, monounsaturated fatty acid and no saturated fat. Worse for liver, is as bad as alcohol. And low muscle mass, resistance exercise, जो लोग फॉरगेट करते हैं, हमारी महिलाएं ज्यादा फॉरगेट करती हैं, उनकी मसल ज्यादा कमजोर है। सबको वेट्स के साथ या थेराबैंड के साथ एक्सरसाइजेस 5 मिनट एवरी डे, अपार्ट फ्रॉम वॉकिंग एंड योगा विच विनीत हैज सेड, 3 टाइप्स ऑफ एक्सरसाइजेस मस्ट बी डन। अब आप एडजस्ट कर लीजिए कौन सी कब करनी है, लेकिन डेली करनी है। और replacement of carbs and saturated fatty acid with protein, increased protein depending on kidney function. तो thank you so much. हम ऑर्गेनाइजेशन कमेटी को पूरा थैंक करते हैं, और मैडम के सामने हमने बात करी तो हमको बहुत अच्छा लगा, और मेरे साथ पुनीत जुड़े हुए हैं, डॉक्टर डोगरा, सब लोग, थैंक यू सो मच, आप लोग आए और मेरे पास।
Thank you, sir, for enlightening us with the important information in a very beautiful layman language. Thank you, sir. It is my privilege to announce today's keynote speaker, Dr. Sonal Mansingh, a revered artist and a cultural icon whose contributions to wellness and holistic living makes her an ideal voice for today's discussion on managing diabetes, an integrated approach. Dr. Sonal Mansingh has dedicated her life to preserving and promoting India's rich cultural heritage, using her art to inspire generations towards an active and balanced lifestyle. Recognized with some of the India's highest accolades, including the Padma Vibhushan and the Rajiv Gandhi Excellence Award. Dr. Mansingh is celebrated for her innovative work that combines cultural wisdom with insights into well-being. Her renowned choreographies such as Devi Durga, Mukti illustrate her belief in a harmonious life. Her activism is as one of the Navratnas for the Swachh Bharat mission further highlights her commitment to public health and community well-being. Dr. Mansingh's life journey exemplifies this philosophy, and her insights today will inspire us all to embrace holistic wellness. Let us all welcome Dr. Sonal Mansingh ji.
Namaskar to all of you, and especially to all the Vidwans. I think you are all Vidwans here, and especially to the scholars. I mean, I call them scholars anyway. They're great doctors, and I want to especially thank my friend Malashri Lal Rumu, who had me invited here. I was thinking recently, that's from last year, I have started a new Natya Katha. It's one of my own presentations, which I don't think any other dancer or musician or actor is doing, where I sing and dance and do abhinaya, give narratives. And the last one is Meera, which started from last year, has become quite popular. And I was thinking that Meera, who was married in Chittor, that was about 600 years ago, and left the great fort of Chittorgarh and the royal environments on foot. She walked out, she walked to Vrindavan, she walked all the way to Dwarka. I don't think she had diabetes at all. The point is well taken from all the previous speakers. Shariram adya khalu dharma sadhanam. Yes. I speak about my own art, that we treat the body as temple, mandir. Just as we remove our footwear outside. Preferably we go with clean clothes after a bath, and we remove the footwear, we enter the temple, we pray, we worship, we do our rituals, whatever, meditation. And then where do we do that? That's in front of the sanctum sanctorum. And for us in the body, the space within the heart, Chitta Ambaram, Chidambaram, that is the sanctum sanctorum, where our Chetana lives, alive, the divine spark. So if we treat body as the temple, then how can we allow it to deteriorate, to become unclean, to become unbalanced? But it has been happening, and as I talked about Meera, I was also thinking about the construction sites which are all over, strewn all over Delhi and in other cities as well. If you see those women and those men, thin, carrying a load of bricks on the head, walking up, walking down, doing all kinds of things, and a little half an hour respite with the rotis or whatever they brought. Sometimes roti and onion and little salt, or little sabji. So what is it that keeps them so fit? I've spoken to a few, so I can tell you. It's not just my imagination. And all these things combine ahara, vihara, vichara. Vichar is thought, the mindset, the attitude. We are what we think. And self-healing, that was also mentioned. Self-healing happens with our own thoughts. I recently read a case, Indian in USA, was diagnosed with very, very serious disease. Life could not be sustained beyond 2 weeks, he was told. And he was a great believer. He prayed and he decided he's going to tell himself and the divinity within himself, come on, heal me. And what do we know? He pulled on for another, he's still alive. And he's completely healed. My own experience, Rumu knows about it, where I met with a very bad car accident on the Autobahn in Germany in 1974. I was at the peak of my career. I still am, by the way. Another peak, there are so many peaks to be climbed. And at night we were returning from Nuremberg to Bayreuth of Wagner, the great music composer. It was drizzling. The small Volkswagen at that time didn't have safety belts, and the small Beetle Volkswagen has the dicky in front. So when you go for a night, it's empty. The machine is at the back, and a deer ran across, and my fiancé put the brakes on, and the car toppled, made somersaults, 3 somersaults, and I was thrown out. I was thrown out on the Autobahn. 12 vertebrae broke. I still don't have 12 vertebrae, by the way. And ribs, so many bones, collarbones. My collarbones are still not fully formed again. What saved me was the circumstances, of course, and the grace of God, but that self-healing willpower after the initial shock and the initial loss of hope, when you have to tell yourself, hey, come on, you are there. Abhi dam hai, abhi jeena hai, abhi kaam baki hai. So, with all the wonderful help I got in Montreal, chiropractor, who put me on my dancing feet within a year. And when he made new x-rays, after my 2 months of dancing in India and going back to get another set of x-rays done, final results, he jumped for joy and he said, you've made medical history. You're a miracle, which I think I am indeed. We all are. We all are. That there was a natural bone which grew like a bridge between the 11th and 13th vertebra. So I'm standing here with that bridge in my spine. Self-healing is very, very important, whether you speak of diabetes, whether you speak of cancers of various kinds, whatever. I was talking about ahar, vihar, and vichar. So with vichar, all these thoughts have come. Ahar is our diet. Enough has been said about that. But in my successive years of my own performances, my tours, travels, and my students, 47 years of my institution today, I have seen generations. And how how the change is happening right before my eyes. Today, I have to keep pushing this finger with which they do the laptop and the mobile typing. They're not able to have their fingers and do these kind of exercises. The 90 degree doesn't come. It's like that. 90% of students, boys and girls. It's really very, very disheartening because they sit hunched over their machines. What happens that you crunch your inner organs as well. And all the things we are talking about, your pancreas, your gallbladder, your liver, your kidneys, whatever, all that, they do not get enough flow of energy through the blood. Ahar and regular exercise, of course, but what kind of exercise? Yes, yoga, yes. Yoga is very important. But yoga is, dance is dynamic yoga. This is Hatha Yoga. If you can manage, I would say, recommend you all become dancers. Even for 5 minutes. Move. Put on some music and move and jump and go on toes and do your hand movements, your neck movements, stretch, whatever. Allow your body to breathe and inject some grace in yourself. Grace. Grace, which is inherent in us. It's very easy to walk and do things like a robot, like a machine. When you inject grace consciously, then it becomes Nritya Yoga. I recommend it very highly, 5 minutes a day. Food, diet. Yes, we should not eat too much, we should not eat too little, according to our own wishes, our own taste, our own, situation. I have known people who want food, nourishment, but they don't have. And then I see marriages where tons of food is wasted. I'm including all this here because most of the diabetic people are found in these marriages and these functions. And they are dumping food on their plate. So whenever you see some, I think you should be suspicious of them. Ahar, Vihar. In this Vihar, you have all your things of walking, dancing, swimming. While sitting, if you just start raising your toes and allow it to be felt in your stomach, if you do that right now, if you can do it. Sit straight. Sit straight, please. You've been sitting like that and like that, now sit straight. And raise your toes and slowly put down. If you sit straight and you do this consciously, sir, you will feel it in your stomach. Do you? This is a very simple exercise, very effective. It affects all your inner organs. Even if you're not able to do big exercise, consciously, continuously do this. Even after a meal, after 10 minutes you can start this and you see the results. Ahar, Vihar and Vichar, I told you. And then I come to this Vyayam and Pranayam. As a dancer, we work top to toe. We do not ignore any of the minor limbs, as we call them. The major limbs are your head and your torso, your 2 legs and your 2 arms. These are the major limbs. The minor limbs, like eyebrows, eyes, nostrils, neck, shoulders, elbows, wrists, each finger, torso, special movements for torso to move independently from the waist. Then your waist movements, your thighs, your knees, your ankles, your toes, and each foot either on heel, on toe, on the side, or flat. All of these have wonderful results on all your inner organs. There's a whole chart, and which works so beautifully. You hardly see any dancer fall sick. You hardly see any dancer having a headache. I've always said I've never had a headache in my life, touch wood, because the movements of the eyebrows, movements of the eyes, I don't wear glasses still, I'm 81. I read, I walk, whatever. I can sew. Why I say this is how important it is to understand one's own body. We can go to naturopathy, we can go to doctors. Yes, it's very important to have regular consultations to see that you are really well, nothing is wrong. But why can we not treat ourselves on daily basis, just to work with the body? I have written this Vyayam Pranayam, stretching, breathing, keep body limber, don't allow body to master you, rather you master the body. Body says, as Dr. Misra ji said, Anoopji, he's left, has he? No, he's here, sir. That I'm tired, okay, tomorrow, आज 10 मिनट कर लेती हूँ, आज 2 मिनट कर लेती हूँ, कल 1 घंटा करूँगी, I'll, sort of make up. There's no making up. The body does not allow you that luxury. It's a strong, there's a demand, and if you do not fulfill that, the body becomes lazier and lazier and lazier, and you feel, हाँ ठीक है, आज तो फिल्म देखने बैठ जाती हूँ, टीवी पे अच्छी फिल्म आ रही है, आज तो ये है, आज तो किटी पार्टी में जाना है, आज तो डॉक्टर्स की कॉन्फ्रेंस है, आज तो विदेश जाना है, आज तो 100 different reasons to say tomorrow. No, there is no tomorrow. It has to be today. क्या है? काल करे सो आज कर, आज करे सो अब. Why? पल में प्रलय होएगी, प्रलय बहुरी करेगा कब. But आज की कहावत क्या है? आज करे सो काल कर, काल करे सो परसों. इतनी जल्दी भी क्या है यारो, जब जीना है बरसों. But there is no guarantee of that anyway. So therefore, that same old proverb, काल करे सो आज कर, आज करे सो अब. उसके बाद मैं आपसे ये शेयर करना चाहूंगी, मनोयोग. ये एक शब्द मैंने हमारे यहाँ है, मनोयोग. मन, योग of the mind. Yoga of the mind. So how would the mind do the yoga and control the body, control the energies, balance your energies, the left and the right, the yin and the yang? Unless they are balanced, when you say you do the Anulom Vilom, है ना? आप करते हैं चंद्र नाड़ी, सूर्य नाड़ी, at certain times in the day. They are even, they are balanced. At other times, either one of them is working. All this is so scientific, so related to our body, but that is Mano Yoga. I have seen, I've done it myself, although there are times when you should sleep by 10 o'clock, latest 10, 10:30, 9, whatever. You are not able to sleep, you have work to do, and by 12 o'clock midnight, your Surya Nadi is again active. You can't sleep. Mother Yoga say, I have brought Chandra Nadi to work, which cools down the system. I fall asleep like a baby, and I get up at the stroke of 5 or 6 or 7, whatever I've thought of. That is Mano Yoga. I recommend it very highly, but that same Mano Yoga, we can treat our own body till, I fell down, not fell down, but I sort of at night, मैंने कहा पीछे जाके मैं पलंग पे बैठी हूँ पीछे जाके पलंग पे बैठी I missed one step. No, I don't switch on lights at night. I don't know what I was thinking. The hard end of the wooden frame of the bed hit me. So I sat there for some time, and then this Mano Yoga started. The consciousness seeped in. What happened? Why it happened? Now what? And I start sending my thoughts, my energy, and my breath to that point. And believe you me, I was able to stand up. I was able to sleep. Next morning, I got up with no hint of that fall. That is Mano Yoga. So my own experiences I share with you, that we have it in us. Why diabetes should happen? India is the diabetes capital of the world. Is that a good upadhi? Is that a good title? I think it's shameful. But it's happening more and more. Junk food, we've talked about, we heard about the junk, we all know that. Obesity, junk food, bad food. Swiggy is there, and Zomato and tomato and whatever is there. And you open the can, and you open this, and you open that, so all the residue of the aluminum or whatever is also there, drinking tea and coffee from plastic cups. And we know that, and yet we are unable to stop, we are unable to convince people, we are unable to say, 5 minute और हो जाएगी, कोई बात नहीं, अभी का अभी ये लाओ, ये लाओ, ये लाओ. How do we explain this kind of a betuki hurry, this kind of unreasonable mindset? My request, my nivedan to all my listeners wherever I go, and to my students and their parents. आज सुबह मैं भी गई थी एक गेमिंग, ऑनलाइन गेमिंग अभी बहुत चला है. There was a press conference about that, and we demanded, 4 of us, there's a law, but it's a toothless law as usual. How to stop people from going online, committing suicides, taking loans, not able to return them. Not only the person, but the families after them in debt have committed suicides. And the whole Ankara was their percentage. And there also I spoke of this, that in schools and colleges and conferences and seminars and on television channels, wherever, we should talk about Mano Yoga. Train the mind, influence the mind. There are many influencers, no? Social media, even Prime Minister Modi, उन्होंने क्या किया था? Honor किया था last year. But are these influencers doing anything? Can we all become influencers for that? Can we all become ambassadors of good thought, ahar, vihar, vichar? Can we tell our own children, our neighbors, our friends, can you convince them? Let's start from ourselves. It's a far cry to say patients के लिए, आपके अपने घर में क्या हो रहा है, उसको देखिए पहले, जांचिए, among your staff, among your team, in your neighborhood. Let's start from there. So, I have much to say, but I won't say it because I think you've heard enough. And I'm sure there's tea and coffee waiting for you. But yeah, शरीर को थोड़ा कष्ट हरूस देना है. वही तो डॉक्टर मिश्रा जी ने कहा, ये जिम वाली जो एक बला है, वो पहले नहीं थी. जिम, I'm gymming. हमने तो कभी जिम नाम ही नहीं सुना था. There's a gymkhana club. But gymming, fashionable. You buy special clothes, you buy special shoes, And you go and you pay fees and you have instructors and all that fancy stuff and this networking there. क्या करना है जिम जाकर? पैसा ज्यादा है तो चैरिटी करो ना. पैसा ज्यादा है तो अपने आप पे खर्च करो अच्छे से. तो मैं इसका भी सोच रही थी that new terminologies have come in our lifestyle, in our thinking. Can we not also talk about these things? और कुछ, I think Raju Srivastava, the comedian, he died in the gym. He had diabetes. He died. There are others also, other examples. We have to remember all this. It's become a, क्या कहूँ, as you said, tsunami, pandemic. And unless we really consciously go out there, talk about it convincingly, simply, ये सारी जो terminology मैं देख रही थी, मुझे पहले नहीं पड़ा, मोटा समझ में आ गया. How do we convince people? ये इनका business खराब हो जाएगा डॉक्टरों का, लेकिन doesn't matter. I think we can do that. आहार के साथ मैंने जोड़ा है अन्न. श्री अन्न तो बताया उन्होंने, मोदी जी ने फिर शुरू किया श्री अन्न. cereal, I mean, what do you call them? Millets. अन्न क्या है वो एक आखिरी बात मैं करना चाह रही हूँ. अन्नमय ब्रह्मम. ब्रह्म जो है, the nameless, featureless, attributeless, formless power, जो कॉस्मोस में छाया हुआ है, सृष्टि में छाया हुआ है. But our Purana, our Shastras say Annamaya Brahma. And what is that Anna? One is the intangible, one is the tangible. The tangible Anna we have every day. The intangible Anna is what we should seek. And that Anna with which our Panchakosha body is made, the 5 layers. The first layer is called Annamaya Kosha, which is made of Anna. Second is Jnanamaya Kosha, the knowledge of who I am, why I am, where I am, what I should eat, not eat, phalana, timka, all that jnana. Third is the Vijnanamaya Kosha, the third layer, even further. First was Annamaya, second is Pranamaya, where your breathing becomes prana, it nourishes you. Just हवा है ना, ये हवा है, दिखती नहीं हवा, you are breathing. We are not even aware we are breathing. You become aware, you regulate it, it nourishes you. There are sadhus and rishis and munis and who have lived only on air. So, Pranamaya Kosha, Jnanamaya Kosha, Vijnanamaya Kosha, and Anandamaya Kosha. The last layer is Ananda, that absolute blissful state, Ananda, which is the key to understand Bharata, our traditions, our philosophy anyway. With all this talk and English terminology, मैं यही कहूँगी कि हमें ये भी समझने की आवश्यकता है. योग का एक पार्ट है, योग तो बहुत है, चित्तवृत्ति निरोधक योग, फिर गीता ने कहा योग कर्मसु कौशलम, बहुत सारी डेफिनेशंस हैं. Just for me, the one thing is, everything should lead to that moment, to that state of being blissful serendipity. If that doesn't happen in our lives, all the talk बेकार है. मैं आपको बहुत धन्यवाद देती हूँ. Thank you very much for inviting me here. And may we all live happily and healthily. May we all live happily, healthily. Thank you. आप बिल्कुल रोल आउट कर गए.
Thank you, ma'am, for enlightening us of how art, dance, ahar, vihar, and which art can impact so much on our well-being. I would like to invite Ms. Tanusha Joshi, Secretary of Venu Charitable Society and Managing Director, Venu Eye Institute and Venu Naturopathy Centre, who is the architect behind the foundations of an integrated approach that has shaped the Venu Naturopathy Centre's philosophy. In the service of our patients, I invite her to conclude today's discussion.
Good evening. It's not an easy task to conclude a dialogue which we are just initiating. The vision statement of Venu has been good sight and quality life for all. 44 years ago, we started this journey. Dr. R.K. Seth, who's a founder, he converted his private practice into a trust to serve the poor and needy. And the aim has always been to have a very holistic approach, responding to the needs of the patient. And as part of the responding to the need of the patients is the reason why the Venu Naturopathy Centre has come up. You heard Dr. Dogra also talked about the challenges that diabetes is giving to eye care. While cataract and refractive errors are one of the major causes which we are able to deal, but the complications that come with diabetes, even for cataract, even in the space of the diabetic retinopathy, it's all to do with our lifestyle. So we cannot undermine the importance of managing. So even for us in Venu Eye Institute, when we talk about the eye hospital, management of our patients also is important, that the lifestyle disease, especially diabetes, is something that we address. So because it's a need of our patients, we responded by starting a setup where we can also help the patients. And we're talking about lifestyle, we're talking about Ahar. We did this inter-school poster painting and slogan competition for children, and a lot of students came on Sunday. Some of the winners are here today with us. And the question was that we will give them a small goodie bag. What do we give them? Chips? Juice? So much, I hope the children here haven't been cursing us. So we decided to put coconut water, millets upma, and fruits. But then I was talking to my team. I said, we are hosting this, this initiative, the public interest talk, which is primarily the audience who are diabetic at Habitat, who don't have a concept of a naturopathy diet. So we apologize in advance for the high tea that we are going to serve, but I hope it hasn't been that, unfortunately we have a constraint of time. I hope the tea is still there, or some energy has ensured that we go without tea, so we avoid the high tea. The dialogue we have just initiated, modern medicine definitely cannot be undermined. When we look at the diseases that we are able to tackle today, the life expectancy that has increased, all this is a boon of modern medicine. It cannot be denied, but we also cannot ignore the wisdom of our traditional medicine, which we also heard about, and there is a scientific basis to all of that. So the effort that we are doing, and this is the first of the series of this dialogue, and we have Dr. Puneet Misra here. I had also met Dr. Anand Krishnan, who is the head of the Community Medicine Department in AIIMS, who also is promoting this integrated approach. So we are just initiating a dialogue. It's a challenge. It's an uphill task. But we know, as they say, no success is achieved without obstacles. There are a lot, not only bringing the people together for dialogue and working, complementing each other, and specifically in the case of naturopathy, we are not stopping medication. We continue. The treatment automatically will bring about changes that will either taper your medicine or withdraw the medicine. And Dr. Anoop Misra also talked about the food habits everyone has talked about. I think somewhere, our generation at least, we saw a lot of things coming in. They were not so much available earlier when we were children, but there was so much again available that I think we got greedy. When you see abundance, you start getting greedy. Our children have also suffered, but a very interesting thing I see now, and I think all of us see, that for our grandchildren, our children are very particular. No sugar till the age of 1. No salt, no water. There's so many things that they're saying no to. And I think recently there was a newspaper article which says that if a child is not given sugar till the age of 1, 35% chances are less for becoming diabetic. I don't know how far that is true.
First 1,000 days of
First
after conception.
So it is true. And I think that our children are becoming much better. They are much more aware. So hopefully there is going to be better management of health issues. But it's a humble step we've taken today, and it's just the beginning of this dialogue. And I hope and pray that we will see this evolve as an integrated approach, both complementing each other. Thank you so much.
Okay, now I would like to invite the awardees, our young attendees. So, Riya Sharma from Kasturba Balika Vidyalaya for winning in the poster category. Shaheen Pratap Singh, Aryan Kumarji for winning in the slogan category.
They are outside. So we made this beginning because we've seen children, like you said, somebody has to mind us. I think children will mind us. So we are involving them in this crusade of spreading awareness about diabetes. So the posters and the slogans are put outside. And I think they'll also get them. Yeah. Can you show the posters? Yeah. So this was the first from Vasant Valley School.
Yes. Got it.
She hasn't come.
Okay.
Can we request the children who are here to come up?
Riya Sharma, please.
Riya?
Can you come? Shaheen Pratap Singh ji.
आप आइए डॉक्टर मिश्रा जी
आप
आइए आप हाथ तो दीजिए आपके आशीर्वाद आप इतना नीचे मत यस स्लोगन क्या है
Shaheen Pratap Singh.
श्रीहान
Shrihan Pratap Singh. Aryan Kumar. From General Raj School. These both kids are from General Raj School. Amaya Abhilash. Mohammad Maroof. And Jatin Kapasia. Amaya Abhilash from General Raj School. Mohammad Maroof from DPS Mathura Road. And Jatin Kapasia from DPS Mathura Road. I would now like to invite Dr. Maria for the vote of thanks.
I'll just take 1 second, Dr. Maria. हम लोग अंग्रेजी में तो बहुत बोल गए हैं, लेकिन हिंदी भी चलती है. हिंदी में डायबिटीज को क्या कहते हैं? मधुप्रमेह. मधुमेह. मधु यानी शहद. तो शहद जैसी मिठास तो होनी चाहिए, लेकिन एक हमारे उस्ताद थे, मैं नाम नहीं बताऊंगी, उन्होंने हमें हंसते हंसते बताया, उनकी बेटे ने, कि उनकी तबीयत अच्छी नहीं रहती थी, तो टेस्ट करा लिया. वो दिन में इतना रियाज करते थे, लेकिन आवाज इतनी अच्छी नहीं थी. नमाज भी बहुत पढ़ते थे 5 बार. तो जब रिजल्ट आया तो अदब से खड़े हो गए बच्चे. हाँ बेटे बोलो क्या है? तो कहा कि ये है. ये क्या बला होती है? तो के इसमें से मीठा जा रहा है. या खुदा मिठास भी दी तो कहाँ.
Thank you, ma'am. And congratulations to all the winners. And now I invite Dr. Maria Libreros, Executive Director of Venu Naturopathy Centre, to propose a vote of thanks. She is a general practitioner with diverse international experience and a strong background in healthcare and emergency response. She was trained in France and Colombia with hands-on experience in the UK and India, skilled with hospital management and crisis response, especially during COVID-19, experience in emergency healthcare operations in Colombia. She is specialized in healthcare for low and middle income countries. At Venu Naturopathy Centre, she is now dedicated to promoting integrated approaches to healthcare and advocating for a dialogue between naturopathy and allopathy to promote better patient outcomes. Let us welcome.
Good evening, everyone. On behalf of the Venu Naturopathy Centre, I would like to extend our heartfelt thanks to each of you for joining us today for this impactful conference on managing diabetes and integrated approach. This gathering marks a meaningful step towards awareness and holistic management of diabetes, a condition that affects millions around the globe, and particularly in India. We appreciate all the distinguished speakers who contributed today to creating a more holistic view of diabetes management. We were truly honored by the presence of an exceptional group of speakers at this event. Leading the way, the keynote address was delivered by Dr. Sonal Mansingh, esteemed Padma Vibhushan awardee. Dr. Mansingh has devoted her life to preserving and promoting India's rich cultural heritage, using her artistry to illustrate and inspire a balanced and active lifestyle. As founder-president of the Center for Indian Classical Dances, she has trained countless individuals, demonstrating how the arts can cultivate health and harmony for the mind, body, and spirit, principles that align closely with naturopathy's holistic approach. She inspired us today to treat our body as a temple and believe in our body's self-healing abilities and much more. We were also privileged to hear from a diverse panel of experts from the Venu Naturopathy Centre and other respected institutions who shared insights on how naturopathy, nutrition, physical activity, and lifestyle changes can complement conventional treatments for diabetes, creating an integrated approach to managing and preventing complications. Dr. Moria, Medical Director of the Venu Naturopathy Centre, offered valuable perspectives on the unique benefits of naturopathy in diabetes management. Dr. Dogra, Medical Director of the Venu Eye Institute and Research Center, provided a comprehensive look at diabetes-related vision health. Dr. Puneet Misra, Professor of Community Medicine at AIIMS, shared findings from his study on the impact of yoga therapy on diabetes within communities, inspiring us for cost-effective interventions which can generate durable change in patients. Dr. Anoop Misra explored and explained a comprehensive understanding of diabetes specific for South Asian populations. Together, they offered practical, actionable guidance on dietary planning, stress reduction, and exercises to help maintain healthy blood glucose levels. And of course, to our wonderful audience, thank you for your presence, attention, and thoughtful participation. You have brought this event to life, and we hope that you leave here today with valuable insights. A special congratulations to the winners of our Managing Diabetes Through Healthy Living drawing competition. Your creative contributions have added another layer of inspiration to today's event. A particular thanks also for teachers, administrative staff, and parents who accompanied the students and made this drawing competition a success. We would like to thank our enthusiastic panel of judges, Mr. Tarun Basu, Dr. Preeti Singh, Mrs. Rekha Jain, Mrs. Prerna Jain, Mrs. Bindu Dogra. A heartfelt thank you for the press for your support in spreading the message of holistic health and wellness from our event. Your coverage is invaluable in helping us reach and inspire the community. We would also like to thank India Habitat Center for providing us with this excellent venue and the seamless logistical support, in particular Mr. Sunit Tandon, Director IHC, and Mr. R.K. Agarwal, Assistant Director IHC. Your cooperation has been invaluable in creating a welcoming environment for our attendees, and your consistent support in all of Venu's activities has been key in making our screening camps a success. We look forward toward our continued association. To the members of the board of the Venu Charitable Society, thank you for your continued guidance, support, and encouragement. To Mr. Chandrasekhar, Mr. Dinesh Bhatia and his team, our thanks for their creativity and enthusiasm on our social media campaign. To our organizing committee and the dedicated team at the Venu Naturopathy Centre, thank you for your tireless work behind the scenes. A special mention to Mr. Satish Kumar, Mr. Chauhan, Mr. Amit Kumar, Dr. Anshika Pathak, and Mr. Ibran Ali. To the logistics teams at Venu, thank you for your continued support and dedication. Your attention to detail and commitment to making this event a success has not gone unnoticed. We are grateful for your dedication and teamwork. As we conclude this event, let us remember the importance of raising awareness and taking collective action to manage lifestyle diseases like diabetes. Together, we can inspire healthier choices and support one another in the journey towards wellness. Thank you once again, and we look forward to seeing you at our future events. Thank you.
Thank you everyone for being a part. Thank you so much. Everyone can have their ID over the left side when you will exit from the hall, over the left side.